Hello, welcome to the Comeback Seat. I am Tanya Russell, the host of the show. And today we're talking with this expert of who is my physical therapist, Brady. Say hi.
Hello. Good morning.
Good morning, good afternoon, good whatever. Yeah. Yeah. So I usually do comeback stories, and I'm sure Brady has his own comeback, but I also really emphasize on tools from a toolbox. I think physical therapy, I think personal training, counseling, they're all tools for a toolbox. And I think my biggest comeback has been my physical therapy, my personal training, my occupational therapy. So I know a couple of weeks ago we had Min on who is a physical therapist. Actually, he uses a different type of posture, occupational therapist, posture expert. And he is in town. He doesn't take my insurance and he's hard to get into sometimes. But so is Brady. Brady's really good, but he takes my insurance. So he's blessed with me.
There you go.
Brady, tell us a little bit about you.
Yeah, so I've been a physical therapist for 18 years now. And I have been in Salem, Oregon my entire career. I graduated from the University of Utah in physical therapy, so I got my doctorate in physical therapy there. And I love to help people to improve their quality of life and to just try to find as much joy as they can. I love my life. I love to live life. I want to help other people to enjoy their life as well.
You just answered all my questions. I was kidding. How long is schooling for physical therapy?
Yeah, so you get your bachelor's degree. That can be in anything. You just have to meet certain prerequisites, and then it's 3 additional years beyond that for your doctorate in physical therapy.
And I was hoping you'd tell everyone that you're from Hawaii. I think that's a cool.
It doesn't look like it. If you look at me, it does not look like I have any level of tan whatsoever. But I was born and raised in Hawaii, so my skin is white, but the blood inside of me is, I like to say, is Polynesian. So
yeah, and your son got married in Hawaii.
Yeah, we married a Tahitian island girl who we love, and yeah, he's living in Hawaii and loving it.
That's awesome. I would love to live there if I could afford it.
Me too. Me too.
Okay, Brady, tell us. You love to help people. You go through this grueling schooling, and then your first job was here in Salem, and you were there for how long?
So I actually stayed with my first company for 16 and a half years, or 17 years. Yeah, so I was there for a long, long time, and I loved it. It was a great company to work for. Made a lot of really good friends. Met a lot of really neat patients with awesome stories, and
I was one of them. We won't tell the whole story.
You'll get the whole story there. And yeah, just happy as could be. And then it just felt like time for a change after I had been with one company for my whole career. And I found healing motion physical therapy.
Yes.
And I could not be happier with the company and the culture and the opportunity to provide care the way I like to do it. So
yeah. And I started out in South Salem at the Healing Motion at the other location, and then they expanded to here. And this is a huge facility. We'll show a clip of the facility at the end of the show. But why did they decide that they wanted to come out to Keizer?
Yeah, so this company started down in Philomath and Corvallis, and they have a really nice synergy down there with their kind of multiple clinics in a small geographical region. And then they expanded to Salem for that Salem office, and it was a little further isolated. It was a little more isolated. They also have one in Eugene that's isolated, and it's harder to get that synergy when you're the only clinic in a geographical region. So they reached out to me and asked about potentially having me run a clinic in Keizer, which I was thrilled with. I'm from Keizer, it's closer to home. And it was just a great opportunity for me to do something that I love in a new space, in a community that I love, and just be able to grow and expand my professional skills and start a new team that I could help to create that culture with. So.
That is awesome. Now, what are the different types of physical therapies? Because I have to say neuro, and what are all the different types?
Yeah, there's a ton. There's actually really a surprisingly amount. So orthopedic is what most people think of, muscles and joints and bones. There is neurologics, people that have problems with the neurologic system. It could be a stroke, it could be Guillain-Barré, spinal cord injury, Parkinson's, degenerative conditions, multiple sclerosis, dizziness and vertigo also fall into that neuro category. Geriatrics is another subcategory. Geriatrics are older adults. And, it comes with the whole host of challenges, but we know that the population is aging, and so there's a huge need with geriatrics. Pediatrics, working with kiddos, is a subspecialty. Pelvic floor, there's a huge need for individuals with working on the pelvic floor, things like incontinence, leaking, things like that. There's cardiopulmonary. There's actually skincare, wound care, a subtype that focuses on that. There's really sports, physical therapy. There's a ton of specialties.
And what do you specialize in?
So I have my geriatric clinical specialty, GCS, which is a board certification. I love working with older adults. And my entire career, I've also loved working with individuals with neurologic conditions. And I specialize, I've seen kind of the full gamut there, especially dizziness and vertigo and post-concussion. But I love it all.
Yeah, it sounds like you don't.
Yeah. Yeah.
Help or heal. I don't know use the word heal, but that's your role, isn't it?
Yeah, it is.
It's to help others with all kinds of conditions that walk through your door.
Yeah. So yesterday I had a patient, a 9-year-old young boy with knee pain that wants to get back to playing soccer. I had an 89-year-old that has fear of falling, and really the full gamut in between. So we have fun with it.
And when someone comes in for the first time to get assessed, what do you have to? How long is the assessment? What do you have to do? Like let's say I'm coming in, hey Brady.
It's a 45-minute assessment. Usually I have very little information. Sometimes the doctor will send more so I can look up, but usually it's a simple diagnosis: shoulder pain, back pain, stroke. First, that's the most important thing, is that history and really learning how this is impacting your life. And then based on what you tell me, then I do an evaluation and see how your body functions, see what causes pain, see what makes you dizzy, see what, how your balance is, how your balance reactions are. Based on those functional limitations that you have. And then from there, from our evaluation, we come up with a plan of care, we identify goals, we give you things to work on at home, we give you things to work on, come up with ideas for things to work on in the clinic when you come in, how are we going to progress you. So it's a lot to do in 45 minutes. And we're kind of going fast, and
sure.
But yeah, that's our approach there.
What I liked about your technique or your style is that my fingers are weak and my balance is off. But I always thought occupational therapists was the ones that dealt with my hands. And that's what I always assumed after 5 years. But you took a look at my hands, and we do weight, we do all kinds of exercises with my hands. So, and then my occupational therapist is more for skills, right? Is that more for?
Yeah. So there's a ton of crossover. There's not like a defining line that differentiates between us. We're both working on function. Typically, occupational therapists are going to deal more with what we call activities of daily living, getting dressed, feeding yourself, cooking, things like that. We're looking at more bigger picture things, walking, being able to exercise, do weights. But I know a lot of occupational therapists that are phenomenal that would do things like helping people with transfer, which a lot of people think would be a physical therapist domain. But and then again, if I just want to look at your function, and if there's something I feel like I can help with, then I'm gonna spend time with that. So.
And I'm not going to talk bad about any other clinics, but what I hear a lot is that it's really hard to schedule at other places. Why is scheduling so hard at physical therapy clinics?
There's a shortage. There's a shortage of providers, shortage of clinics. There's a lot of people that need the help, and it's I mean, for our clinic here,
It's been a breeze.
it's been, but it's getting harder. I'll tell you that now, because now that the word's getting out, more and more. So we're trying to hire. We would love to hire some more physical therapists.
Sure.
And we have the referrals and the patients for them. And it's just, there's not a lot out there. There's more openings than there are physical therapists.
So that's the problem. And I was just wondering also, like, how long, you don't know how long a patient's going to be needing the help that they need.
Yeah, and it's going to vary. If it's something like shoulder pain or back pain, it might be, just a couple of weeks. If it's something like a chronic neurologic condition, then, we really have to define what our goals are, and because we can go forever. You can go for the rest of your life with certain conditions, and that's not the goal of physical therapy. The goal of physical therapy is to improve your function, improve your quality of life, give you tools so that you can then take those tools and work on them yourself. And that's the challenge for some of those more complex conditions.
Yeah. I would say that's just a challenge, like getting an exercise machine in your house.
And then being motivated. Exactly. Yeah, and being motivated to use it and knowing how to progress it, knowing, kind of the next steps.
Sure. Sure. Well, homework is the biggest part too of getting better movement and all of that fun stuff. But I out of all the clinics, scheduling here has been really comfortable and easy. We have Mariah, who's the scheduler over there. We'll do a clip. And Mariah, do you want to come over and say hi?
Mariah is a superstar. And,
superstar. 100%.
Yeah, we couldn't do it without her. I've worked with several really awesome front office people, Michaela and Jenny and the South office, and several, and throughout my career, that I've always said the front office people what makes or breaks our ability to provide care. So
yeah. Brady, do you want to do a little something with my hands?
Yeah. So several things. So I've got some putty here. So we're trying to work on some grip strength and
come up here a little bit.
So again, we're trying to find what your abilities are. So trying to squeeze it and trying to pick hand in different positions.
And he blocks me because I want to compensate somewhere. So he always.
So there's like yeah. For the putty and and it makes a nice big mess.
Yes, and don't do that on fabric, right?
Don't do it on fabric.
What do they say?
It just
Your stuff.
Yeah. Putty? Yeah, I think so. Yeah, it's just not good for it, and it just makes a big mess, though.
Yeah,
we like to avoid those messes.
Yeah. Well, Healing Motion is the place to be at. It is very nice. It is huge, and you're going to bring in a couple more people, and you still will have all this room in here. What else would you like to tell people that might not want to get out the door to come? Because I think physical therapy is such a healing tool.
Right.
And what if I don't want to? I know I have back pain. I know I need to come to see you. What kind of message would you tell them that besides come to Healing Motion, but Healing Motion? Is it
Healing Motion physical therapy? Yeah, it's about finding those things that are going to drive you, that are going to improve your quality of life. If you have back pain, it's really hard to make the time to do something like this to take care of yourself. But what else would you be able to do if you didn't have that back pain? How would you be able to, would you have more energy to be able to spend more time in the yard and get more projects done? So it's almost addition by subtraction, if you will, where by taking time to take care of yourself, it almost frees up more time. And it's just motivating, working with somebody else, finding somebody that you can get along with and that will hold you accountable. Really can make a big difference.
Yeah.
And that's our goal. I mean, that's all we care about is trying to improve your quality of life and trying to give you a hope for a better day.
Yeah. Well, like exercise media said, it's already improved, and I have seen big, significant improvements. And I didn't want to go to physical therapy for a long time, just from experiences out there. And what I've been with you for almost a year now, and at that other location in here, and I appreciate it.
Yeah.
I appreciate what you do for people and how much you help us. And I'm going to have them spam around this clinic real quick, so you might get dizzy. But you can show them, but you just showed me earlier too.
Yeah, there we go. So there's Mariah over there. Just gonna wave. She's the superstar. Here's some checkerboard fabric. We use that for people with dizziness or vertigo, things like that. A balance bar. We got some turf, different weights and different things we can work on there. Big open space, you'll see. And then you can see we've got a harness with a treadmill. So for people that are at risk for falling, we can put the harness on them and really push their balance and improve their confidence, improve their walking abilities, improve their walking speed, endurance, all of that without any fear of falling, which is huge. It really makes a big difference there. So
yeah. Well, Brady, come back over here. So that's perfect though.
Oh, right there.
Your head is still here.
There we go.
There we go. Anything else you want to add to this great podcast today?
It's just been a pleasure. I've said it before, but just seeing how motivated you are and how much love you have for life, even though you've had a lot taken away, is just inspiring. It inspires me to make more of what I have, and makes me want to work harder to be able to help more people to feel some hope in their life and achieve their goals. Thank you.
Thank you. All right. Have a good day. And I'll put a disclaimer on here. And I think we're set. So if you...
Disclaimer. The information shared on this podcast is for educational and inspirational purposes only. It is not medical, psychological, or professional advice. Always consult with a qualified professional before making changes to your health, mindset, or lifestyle. You are responsible for your own decisions, actions, and results. Take what resonates and leave what doesn't, and always do what's best for you.